More than 200 scientists tell WHO coronavirus is airborne, report. To view the full article, click the first link in the description below. Representative photo, AFPNEW YORK. More than 200 scientists from 32 nations have written to the WHO, saying there is evidence that the coronavirus is airborne and even smaller particles can infect people, a significant departure from the UN Health Agency's claims so far that COVID-19 is spread primarily through coughs and sneezes. A report in the New York Times says that clusters of infections are rising globally as people go back to bars, restaurants, offices, markets and casinos, a trend that increasingly confirms that the virus lingers in the air indoors, infecting those nearby. In an open letter to the WHO, 239 scientists in 32 countries have outlined the evidence showing that smaller particles can infect people, and are calling for the agency to revise its recommendations, the report said, adding that the researchers plan to publish their letter in a scientific journal next week. The World Health Organization, WHO, has long held that the coronavirus is spread primarily by large respiratory droplets when an infected person coughs or sneezes. In its latest update dated June 29 on the coronavirus, the WHO said airborne transmission of the virus was possible only after medical procedures that produce aerosols, or droplets smaller than 5 microns. The guidance that the health agency has given to deal with the virus, such as wearing masks, maintaining social distance and frequent hand washing, since the pandemic first broke is based on its claim that the virus spreads through large droplets when an infected person coughs and sneezes. If airborne transmission is a significant factor in the pandemic, especially in crowded spaces with poor ventilation, the consequences for containment will be significant. Masks may be needed indoors, even in socially distant settings. Healthcare workers may need N95 masks that filter out even the smallest respiratory droplets as they care for coronavirus patients, the NEAT report said. It said that ventilation. To view the full article, click the first link in the description below.